this whole comment and then I'll explain after. The fact that the other person went through great lengths to prove you wrong and your response is to block them shows you don't have enough information to be talking on this subject. Seniors cannot swallow due to swallowing issues and chronic pain. Patients can't open pills due to the pain, which is why they're on hard narcotics to begin with. Even with your picture said to wash hands after using, if it's not contact through skin, they wouldn't matter. Tylenol, is the example you brought up, is over-the-counter pain medication that you don't have to wash your hands after. Even in the video, NAS, alcohol is in addition to, so it's not strictly. Perfectly Imperfect has not been pregnant, nor is a medical professional, so does not know what doctors tell mothers who do consume alcohol, what it does to her body and the fetus. Master at misinformation over here, because just block people when you can't prove your way means you're immature and uneducated on the topic. So, for context, someone decided to talk about drug use in a video, and I thought they might have gotten confused with something called NAS, not FASD, and you can watch that video that's attached to this and why I explained they're different. And they talked about how some narcotics like Dilaudid are so potent that even skin contact you can get a contact high from. Said, no, you can't get a contact high from just dried up crushed pills. It's a harmful myth to assume that just by touching crushed pills that you can get high from them. The only way you can get high from them by touching is if you end up having skin breakdown or you have a cut or something and then it goes through your bloodstream. Also, if you're taking high painkillers, you don't necessarily have to wash your hands after taking said pills, just like Tylenol, because yet again, you can't get high from just touching a pill. Why do we wash our hands if we are exposed to drugs? Is because us humans have a nasty habit of touching our face. Hard powdered narcotics go through our mucous membrane. That's the problem. So if it gets in our mouth, then it can go through our bloodstream. If it touches our nose, it can go through our mucous membrane in our nose and go to our bloodstream. If it touches our eyes, it can go to our bloodstream. That's why you wash your hands. And some drugs could irritate your skin. If that drug is on irritated skin and now that skin is breaking down, then you might get a contact high. Maybe. But it is so low. Now back to drinking alcohol and pregnancy. Drinking alcohol while pregnant can happen even if you're not an alcoholic. You do not need to be an addict to cause FASD. Research shows that low to moderate amounts of alcohol that is consumed while pregnant can affect that child. Assuming that someone who drinks alcohol while pregnant is an addict is also incredibly stigmatizing and harmful. And even if they were an alcoholic or an addict and they drank while pregnant, they should not be judged or criticized because they're an addict. And people that have addictions to alcohol cannot just stop cold turkey because it could kill them, which would unfortunately kill the fetus too. You don't have to be pregnant to educate yourself on FASD. Bye!